This is Dr. Jeremy Gurman at Inertia Medical, and today we're talking EMGs, or electromyography. This is a test that you may have had or may have heard of, and it's a test that's quite helpful to people like myself. As a physical medicine and rehab physician, this is a test that I do often, and it gives me a lot of information about patient symptoms. A lot of times patients will come in and say, "Doc, I have numbness, I have tingling, I have weakness, and maybe even pain." And sometimes these are related to different nerve problems, different muscle problems, and EMGs can help us to better figure that out. So what the test essentially does is to determine, is there a problem with the patient's nerves, and if so, how bad is the problem and where is the problem? It also gives us a lot of information about the muscles, and so it can help with conditions like carpal tunnel syndrome or pinched nerves in the neck or the low back. So it can help in that diagnostic process. And what the test involves is really a two-step process. The first step is called the nerve conduction study. And what we do, we'll take the example of carpal tunnel syndrome, which is a problem with the median nerve here in the forearm and wrist. And we can put little electrodes or wires on the fingers, again in this example, and we can stimulate that nerve, that median nerve, and see on the computer how it's functioning, if it's slow or if it's been damaged. And that again helps to guide our care from that point. So that's the first part of the test, is where we stimulate the nerve, we send an electrical signal down the nerve. And the second part of the test is where we use a small needle about the size of an acupuncture needle in different muscles to which that nerve goes. And that also gives us more information. So electromyography, or EMG, is what it's commonly known as, and it's a test that can be quite helpful. So if you have some symptoms, numbness, tingling, weakness, it's something worth looking into and asking about. Speaking of questions, if you have any, feel free to shoot them to us at info@inertiamedical.com. So that's EMGs.